Good morning, members of the committee and other individuals from the public. My name is Blake Williams, a Year 13 student attending New Plymouth Boys High School. Because I'm only afforded 5 minutes of speaking, including questioning, I'll skip all other formalities and jump straight to it. I'm unsure as to who of you have read and remembered my written submission, so I shall go from there. I don't understand why, talking amongst a group of legislators and politicians, I have to be the voice of reason for this outrageous bill. Because, for one, this bill makes a distinction between sexuality and sexual identity, but treats them in the same respect. The former of the two requires no physical intervention, but the latter, transgenderism, and all of the other isms accompanying it, more often than not does necessitate medical intervention. This bill is a first step in stigmatizing identity-based conversations in this country. And you know how I know this? Many of the most prominent proponents of this bill claim it doesn't go far enough. As you may know, individuals such as Chanel Lau released submission templates for her followers to use when writing their submissions. Amongst the proposed changes to the bill included removing the religious exemption and including parents as potential perpetrators of conversion therapy. Even in its current state, let alone with these absurd proposals, the bill is bound to infringe on individuals' rights. According to the Medical Council of New Zealand, it is my right as a patient to be afforded a second medical opinion. Considering the first exemption of the bill is related to health services operating within their practice, this would seem to be a non-issue, correct? Well, what if I said that health providers have a duty to deliver services to the transgender community? This includes, and is not limited to, feminizing breast reconstruction, masculinizing a chest augmentation, removal of the uterus, removal of fallopian tubes and ovaries, removal of testicles, facial feminization, and Adam's apple reduction. When you consider that health providers have a duty to perform these services, while silencing all second opinions, you run into a bit of a problem, don't you? When individuals who are struggling with their identity request a second opinion, not only will they be treated to the same medical advice, they cannot even look to other non-medical means for it. Remember those proposed changes mentioned previously and how I called them absurd? Well, here's the funny part. They're also unnecessary from the perspective of the proponents. This bill in its current format is worded so poorly, parents and religious institutions are likely not going to be exempt in practice. Whether this was intentional or not, I don't care because the effect is the same. According to the bill, one exemption is the expression only of a religious principle or belief that is not intended to change or suppress an individual's sexual orientation, gender identity, or gender expression. So what if it is intended to reassert an individual's identity on the grounds of religion? Are you going to cart the clergy off to jail? Don't get me wrong, I'm not religious in the slightest, but for some people in some communities, the church or other religious bodies is their most trusted or only social support mechanism. This bill will have them walking on eggshells in no time, and a religious persecution will be akin to that of 1660s England. I hope one day I'm fortunate enough to have a little army of my own. However, what I fear now is that your decisions on this bill could prevent me from being an empathetic and loving parent in the future. Why is it that we prohibit minors from voting, drinking, driving, drinking, smoking, having sex, but permit them to make irreversible changes to their bodies while silencing any dissent? I would continue, but I'm not sure if there's going to be enough time for your questions.
Thank you, Blake. We've got less than a minute. I'm a bit worried that you haven't fully understood the bill, but I don't think in a minute we've got time to explain it to you. I think you've gone for the wrong angle. So I just would encourage you to reread the bill and reread some aspects of it because yeah, it will take longer than a minute for us to explain to you what it actually does do, but it doesn't do what you've just said.
Because, yeah, I have read it, but...
Yeah, that's all I've got to say. I just encourage you to read it again and to listen to some of the other submitters to try and understand what the bill is actually about.
All right, then.
Okay, thank you.
Yeah, thank you.